Hey, good evening, everyone, and welcome to this episode of the Ask Dr. MJ. Why? Because your health is important. Facebook Live, Instagram Live, YouTube Live broadcast. Let's listen to the intro song. Dr. MJ Collier, I'm your family physician. Please allow me a moment to dedicate my mission. The original hip-hop doc. Don't you deny it. Check out my curriculum vitae. I can surely supply it. Trying to take my name, sir. Don't even try it. I've been curing ills for years before you even died. Live in the studios, WYZE. Tune in and dial up if you had a question for me. So there we go. We want you to tune in, dial up if you have a question for me. This is the People Show. And as you know, we're going to talk about welcome. Thank you so much for tuning in, because we know that you have options and you have other things you could be doing on this Wednesday evening. But we are so glad that you are here with me listening to the Ask Dr. MJ. Why? Because your health is important broadcast. Okay, so today on Wellness Wednesday on the Rickey Smiley Morning Show, I talked about what's been going on in the news in reference to vaccinations, of course. And so we have an anti-vaxxer and that's leading Department of Health and Human Services. So this is a problem, because the advice that was given out, or the recommendation has been that infants or children, newborns, right out of birth canal, are given the hepatitis B vaccine. And they're recommended that you no longer do that. And so this, of course, brings up the immediate question to people: why not do that? Well, you think about this, and I have said this many times, that the greatest benefit to mankind from the public health department has been vaccines and the vaccination programs. We have saved lives. We have stopped disease from progressing. We have eradicated diseases through the immunization process. Everything else in the healthcare system is incident related. You get sick, we treat you to try to make you better. But this is a proactive, preventive way to improve your health, and it has been amazingly effective, particularly with the hepatitis B vaccine. This is also relatively recent. The hepatitis B vaccine became a routine part of vaccinations in 1991. In 1991, that is when people started using vaccines and the hepatitis B vaccine. Prior to that, around 20,000 kids a year were getting infected with hepatitis B. Now, this might not have manifested itself until the child is about 10 years old. This is a problem, because you end up then, of those, 90% would progress to a chronic hepatitis B infection. For an adult or with someone with a functioning and properly functioning immune system, then you would get hepatitis B and you'd have flu-like symptoms, as they say. You get over it after a couple of weeks, and you'd have immunity, and it wouldn't bother you if you survived it, no problem. A small percentage of people in that circumstance will progress to chronic hepatitis B, but the vast majority of people get over it and they now have immunity to it. Well, in children who have no functioning immune system or immunity to hepatitis B, it would become chronic, and more than 50% of them would develop 50% at birth, and almost all of those, 90% of those, would develop chronic hepatitis B infection. So instead of it being less than 1 out of 10, it was 9 out of 10 that were getting chronic hepatitis B infections, and this would ultimately result in infection. This infects the hepatocytes, or the cells of the liver. They get inflamed, they're chronically inflamed, you end up with liver cancer or liver failure, and you die. That's what was happening. And so they started giving the vaccines. Now that rate has dropped to almost zero. It just doesn't happen anymore. And people say, well, the virus, you take my chances with the virus because the vaccine may not be safe. Well, guess what? There's never been a single death associated with the vaccine. There have been allergic reactions, none of which were life-threatening. There have been a few episodes of what's called anaphylaxis. That is a severe allergic reaction that can happen with anything, particularly with food allergies and things. It has happened with vaccines, but it has happened minimally with this vaccine. And there has never been a case, even with anaphylaxis, of a person dying from hepatitis B vaccination. So it's safe. I recommend it. I think you should get it. I think that if they offer you the choice, and
And that's what they're saying. They're going to either offer the choice to parents at the time. So you need to go in already educated before you in the living room and they say you want to get it and you say, no, I heard I shouldn't get that. Then you need to be educated and prepared and make your desire known before you go into labor that, yes, I want the baby to be vaccinated with the hepatitis B vaccine at birth immediately. They literally take the babies out of the water, clean them up, and start giving them shots. So this is important that you take care of that. In reference to vaccines, it's flu season, cough, cold season. We're going to talk about this in the remainder of the show. But we want to make sure that the next time you go to the pharmacy for anything, you're going to pick up some over-the-counter medications. You're going to pick up a regular prescription that you have. Get your flu shot. You don't need an appointment. You can usually walk in and get it in real time. Make sure that if you plan to get it, that you take the anti-inflammatory Motrin, Advil, or Aleve, and the non-sedating antihistamine, Allegra, Zyrtec, Zylol, Claritin. Start taking it the day before. Take it the day of, and take it the day after you get the vaccine. Your arm won't get sore and it won't negatively impact your immune response. But what it will negatively impact is your side effects from the shot, like fever and other symptoms that you can get, and sore arm after getting a vaccination. So very important that you do that. Dr. Collier is highly recommending the flu shot. I am not recommending per se the new COVID shot. You have to have a prescription for it. The reason that you have to have a prescription for it versus last year when you could walk in and get that as well is because the vaccine that is currently available is based on coronavirus COVID variants that were around in 2024, 1 year ago. They are all offsprings, if you will, of the Omicron variant, but they're still Omicron variants. So if you got the vaccine then, you're not getting any additional immunity by getting the new vaccine, because the new vaccine is really an old vaccine. It's just, it was focused on those variants that aren't even around now. Those variants have gone through the community and have disappeared. There may be, and there are new variants that have come that are still Omicron children, so to speak. They are relatives of the Omicron variants, but you already have immunity to that. So I have read things on medical sites in reference to this, and they have said something as benign as what I'm saying. Others have said that, of course, it's the old virus. Others have said, well, it will give you additional protection against the Omicron virus. Most of us have had the coronavirus or COVID infection at least once. I know I have had it at least twice. Plus, I got injections for it. So my immune system is optimized in reference to the coronavirus at this point. So Dr. Collier is not taking the new coronavirus vaccine because it's not going to offer me any additional protection. But Dr. Collier is adamant about taking the new flu vaccine. And I wish you would be as adamant as well, because more people have died from flu pandemics around the world. And in real time, in your lifetime, there have been flu pandemics. The swine flu, the bird flu. These have all had pandemic-like responses, wiping out substantial numbers of people. People have died from the flu infections, more so than have ever died from the coronavirus. So understand this, that it's a good match this year with the flu vaccine. The flu virus starts on the other side of the world. They get it. They make vaccines based on that. And sometimes as the virus migrates around the world, it changes, it mutates before it gets to the United States. So what was a good vaccine 6 months ago may not be a good vaccine now because it's not a good match. But it used to take a while for the vaccine to get around the world. Now with air travel, it can get around the world in half a day, 18 hours, completely around the world. So the virus that comes is the virus that was over there. And so we now have a very good match with the current flu virus that's infecting the population here in the U.S. now, and you can get great protection by taking the flu vaccine. You get it now, you'll have protection up through March, which is the entire flu vaccine, the flu season, and actually it will be longer than that probably, but you'll be protected from the peaks and valleys of the flu. And remember, there's nothing in the flu vaccine that is disease causing. You cannot get sick from the flu vaccine. It cannot give you the flu. The old vaccine would give you the flu. It was actually what they call an attenuated virus. That means that it was a kind of a modified version, a weakened version of the flu, but it would give you the flu. And the objective was to give you, quote, a mild case of the flu. And in some people, that mild case would be devastating. So now they don't do that. They don't give you attenuated flu vaccine. They give you a flu. They give you a created, like the flu's little toe or pinky finger. It's enough for your immune system to identify the flu as the flu and to fight it and protect you from it. But it is not enough of the flu that it could cause a flu infection in you. So it is perfectly safe unless you have problems with egg allergies, because the majority of flu vaccines are grown inside of eggs, chicken eggs. But there are flu vaccines that are available that are egg protein free, and you can get those if you have that problem with egg allergies. That is not that common, but it is common enough that they ask you the question before you get a flu shot: are you allergic to eggs? And most people don't even know that they are. But if they've had a vaccine of any type that's made in that manner, they had a reaction, then cross reactivity would be there. So there we are on the vaccines. Go get them, and we're going to talk about how you can protect yourself from there. Highly, let's see who we have online. It's time for a roll call. Okay, Cindy Hill from Fort Worth, Texas. Hi, Cindy. Thank you so much for joining us once again. It is a pleasure to see your lovely face. I love your profile picture. Winnie King, how you doing from Terrell, Texas? Since I gave you the advice about the lower backache, I am much better. Thank you always, Winnie. We appreciate that as well. That backache, boy, it affects everybody. Hi, Miss Audrey. Thank you so much for joining us. We know you've had a busy day. We appreciate you. Thank you. Thank you so much. Didn't know that you had not heard it. That song started off on my first radio broadcast. Miss Makiba Boland, good evening. I saw you on the schedule. Thank you so much for joining us this evening. Glenda Everett, good evening from Warner Robins. We appreciate you, Glenda, for being here this evening. Thank you so much for joining us. All right, big time. Shine, big time green. How you doing, man? Monroe, Louisiana. Let's get at it, brother. So glad that you joined us as well. Alice Allen, Chi-Town in the house. There you go. And real men do spoil their women. No ifs, ands, or buts. Miss Love Jones coming in from St. Louis, Missouri. St. Louis, Midwest is in the house. Thank you, St. Louis. Loretta McNair from Aiken, South Carolina. Hi, Loretta, Aiken, South Carolina. Glad to have you join us in the South as well. Linda Thomas Bloomer from Birmingham, Bright Light City in the house with a Morehouse man as a mayor. Thank you so much. Etricia Reese, good evening from Austell, Georgia. She's local. Okay. Deborah Mathis. Hi, Deborah. You didn't tell us where you're from, but we're glad to have you. Thank you so much. All right. She's on Facebook. Jacqueline Miner from Portland, Oregon, also on Facebook. Thank you so much for tuning in. We appreciate you. Betty. Hello, Betty. How are you? She's on YouTube. Thank you so much from ATL. Latrice McGrath Parks. Okay, on Facebook as well. Hi, I see that hand up. Thank you, Latrice. Okay, Judy Austin from Greenville, South Carolina on Facebook as well. Got a lot of Facebookers. Last time everybody was on the YouTube channel. Nisi Reed White, hi, from Indianapolis, Indiana. Thank you so much. Indianapolis is in the house. You might be the first person from Indianapolis. Latrice McGrath from Columbus, Ohio. There you go. Thank you, Latrice. Okay, thank everybody for joining in. Now, this is the People Show. Whatever your topic is, whatever questions you have, let's get to it because we want to answer your healthcare question. So let's get to it. Okay. Cindy Hill, is it too late for me to take Lipodrops for loose skin? I have lost 140 pounds. I have my thighs and arms and loose my face. Lousy, looks slim. It's never too late, Cindy. But one of the things I'm telling people that have had a dramatic weight loss, either through gastric bypass surgery, gastric sleeve, or using one of the SGLT2 inhibitors, that would be the Mounjaro, that would be the Ozempic, that would be Wegovy, that would be Zepbound, or all the generic equivalents that are available on the internet. So if you have done that and you've lost the weight, the thing is that the fat attaches the skin to the muscle, and there's a loose kinetic connection to that. And when you're losing weight, you want to lose the fat, of course, but now you have a gap between the skin and the muscle, and the skin literally is loose. It can fold over itself. It can slide back and forth. It can flap. It can flop. It can slide. All of those things. So tightening up the skin, there are a variety of things you can do. Collagen products are good for that. They have to be utilized every day. You cannot be slack with it. You got to use it sometimes. It requires multiple times per day applications. I would recommend at least twice daily. Wash the skin, moisturize the skin, apply a collagen product. Vitamin D is excellent, as well as vitamin E. I would apply vitamin E oil. You can purchase a really nice sized bottle from the place where everything's $1.25. So you can go there and get a big bottle. I use it on my skin. It is very good for that. And then the Lipodrops will help close that space. it will help close that space. But if it's really too loose and you got enough flap that you can grab it like 2 inches, 3 inches out, then you're probably going to have that surgically repaired. That is the gold standard, of course, to just remove the skin. There are new technologies that are available that can shrink, but they can only shrink so much. I know my laser lipo will shrink the skin. Laser lipo is available in the office. There are other techniques available that use microwave therapy, to use heat therapy. There are other therapies. Most of those treatments are going to cost you anywhere from $1,000 to $5,000. And at that point, you may as well get the skin cut off. That will give you a much better clinical outcome and a much better cosmetic outcome than if you don't do those things. Okay, great, Cindy. Thank you. Tanisha DeLoston, what do you suggest for someone who's taking blood thinners and cannot take vitamin K? One, don't take vitamin K, but you can still take vitamin D. You don't have to have the K. The K is, matter of fact, to be avoided because it can really make blood thinners extra super strong, and all of a sudden you're oozing out, bruising all over. You can really have a bad problem, start bleeding from the stomach. Vitamin K is to be avoided. Dr. Collier had a vitamin D K combination, and for that reason, we stopped promoting it because the vitamin D gives you all the benefits. Vitamin D and K are great together, but you don't have to have them. You just need the vitamin D3, our Doctor's D. Doctor's D, available on the website only, lipodrops.com. The only place that you can get original lipo products, lipodrops.com. You go there, you get the Doctor's D at 5,000 international units per day, and that will give you all the benefits that you want. So when you're on blood thinners, there used to be a block. They didn't want you to take aspirin or aspirin-like products while on blood thinners. Now they're actually advocating that combination of aspirin and blood thinner therapy. All of them are advocating partnering with an aspirin to give you optimal blood thinning outcomes without the danger of excess bleeding. So, but not vitamin K. Vitamin K will bind those prescription strength blood thinners, everything but Coumadin, which is, literally rat poison. And you have to have your PTT, your blood clotting parameters monitored on a weekly basis, which is why nobody should be on Coumadin unless they just cannot get one of the other products, Plavix or clopidogrel. It would be the first that I recommend. It's generic now and least expensive, but there are others as well. But vitamin K binds to them, makes them work. It doubles, triples, quadruples the half-life. And so you don't have ability to clot at all. All of a sudden you start oozing and bleeding, and there are no products that can reverse that. That's one of the key things that they're doing. There's one blood thinner out there now that can be reversed, but it takes a while and it is very expensive to do so. So the objective is avoid the vitamin K. Great question, Tanisha. Real Shawnee, how can I get approved for weight loss injections? You can't. There are new guidelines, however, for the GLP weight loss injections. For instance, the Wegovy, which is the same as, it's semaglutide, the same as the Ozempic, just got the indication for fatty liver. And everybody has fatty liver if you're overweight. So if you there's a specific test that you can get. And if you get that test and it comes up positive, then you can submit that to your insurance company, let them know that you have been diagnosed with fatty liver. And that is the only drug that has been approved, but it's one of them. The other one is $50,000 a month. So I think for logic's purposes, that means they will okay and justify spending $1,200 a month on a GLP-1. So also the prices on all of them has been decreased dramatically because of competition, internet competition, fatigue. People have stopped, or their willingness to pay $1,800 a month has decreased. So now almost every product that's on the market now is available for a cash price of $500 to $600. So that's half the price that it was a year ago. So you can get them, but to get approval, you have to have an indication. For Wegovy and Zepbound, those are weight loss indication only. So an elevated A1C, but not diabetic. If you are diabetic, then it's Wegovy or the Ozempic. If you are diabetic and your hemoglobin A1C is greater than 6.6, then you qualify. Now, there are insurance companies now that have made blanket comments that it is an outlier. They are not covering these shots under any circumstances because they're so expensive. They just don't want to do it. Others will do it if you meet that criteria. So it may require a process called a prior approval, which you can get, but you have to partner. But first, I check with my insurance company to see which products they cover, so you don't waste time going for one they don't cover. And more of them are now covering more of these products. So because the price has been lowered, so they are easier to get. They still make a process of it. They don't want everybody getting this. My personal opinion is within 5 years, these products will be over the counter. People will get them. Why? Because they're safe. Two, because they work. And because they work and they're safe, I can see a movement to make them over the counter. For all practical purposes, they're over the counter now because people go on the internet and do a 2-second survey. And I don't think a single person in the world ever gets told, no, they can't get it. They all seem to magically qualify. And if that's the case, then for all practical purposes, it's over the counter because you don't get continuous guideline or counseling or monitoring from a physician. You you get the product online. They tell you, take this shot, and you do, and people lose weight. And oftentimes they don't have any complications, so it's not a problem. It's only if they get a major side effect or a major complication, then they seek medical therapy. Okay, great question, Real Shawnee. FN Humble One, I have a lump behind my knee. What is that? That is a Baker's cyst in your knee. When you have the top of the knee, the thigh bone, and the bottom of the knee, the leg bone, particularly the tibia, which bears the weight of the leg. The fibula is a little bone on the lateral portion of the leg. They come down together. That is your knee joint. Your knee joint goes back and forth and back and forth. Well, around the knee is a balloon encapsulation. That capsule is full of a fluid called synovial fluid, synovial, that serves as a lubricant so that as your joints move, they don't generate heat, they don't grind each other into a sense of they just grind themselves away, just damage the joint by grinding. So that lubricant is kind of the same as oil in a car engine. So you have that benefit. And so when you do, the problem is that balloon, imagine this. I have a round balloon on my desk and I'm going to pick it up. So I take my two hands, I bring them together, I lift up the balloon, and I'm holding the balloon in my hand. Okay? Visualize the balloon in my hand, a round balloon. Well, now I take my two fists, I pick up the balloon, I put it like this. The balloon is between my two fists. And as I bring my fists together, the balloon wraps around each one. Visualize that the balloon wraps around each part of my hand. Well, that is exactly what happens in the knee. The thigh bone and the knee bone like this, the balloon wraps around. If for whatever reason the balloon gets a bulge in it, and it comes out, the path of least resistance is to go to the back of the knee. That is called a Baker's cyst. Sometimes the lump will go back in and it's not a problem. Other times it twists on itself and now you got a sack full of fluid that's continuously manufactured. The lining manufactures the fluid. So now it can grow. You become a space occupying lesion and can cause pain. So primary therapy for that is just sticking a needle in it and draining it. So I will do that up to 3 times. But the body has an amazing ability to heal itself. When that happens and it heals itself, then you have to go in and take the balloon out, or at least a portion of the balloon. So that is a little more intensive surgical procedure that I used to do, but I don't do anymore in the office because you have to, quote, have a surgical center. So when that happens, you have to have that removed. And you also want to have it repaired in a way that you still have the protective fluid surrounding the joint so the joint does not grind itself into a dry, like rubbing your knuckles together with sand between them. So you don't want that to happen. You want to do that. So that's what you have. That's what that knee is, a Baker's, BAKER' cyst. Google that and you can see some nice pictures of it. Okay, great question. Natalie West Montgomery. Natalie, I love that name. That sounds like that ought to be on a reality show or something, like Blacks in the White House or something. I don't know. Good evening from Florida. What is the best way to manage kidney function when you have a family history of renal failure? At my last appointment in August, my levels were 2 points below the cutoff. The cutoff is 60. That we're talking about chronic kidney disease, or CKD. The test that you define that with is called the glomerular filtration rate, or GFR. This tells us how effectively and how efficiently your kidneys are filtering your blood. That number should be 60 or greater. The higher that number, the better. People with kidney disease is defined when it falls below 60. There are stages, stage 1 through 5. 5th stage is when you have a chronic kidney disease, CKD, stage 5. Now you're on dialysis. So the most simple thing that you can do, remember that test is called the glomerular filtration rate. When the filtration rate is low, that means there's not enough fluid to filter. So the first and simple and most elegant thing you can do is to make sure that you're drinking 8 to 10 glasses of water per day. That will give the kidneys more fluid to filter. Ergo, the filtration rate goes up and the kidney function. The kidney has an amazing ability to heal itself. The kidneys and the liver, those are the two organs that can literally repair themselves and be as good as new, provided the damage is not so severe. If you're only 2 points away, that damage is not severe at all. You just have an indication that you're headed that way. So drinking the water, and then the problem is inflammation in the kidneys. So anti-inflammatories such as omega-3 fish oil and vitamin D at a dose of 5,000 international units are natural things that you can do. More often than not, this problem is due to primary disease states of high blood pressure or diabetes or both. And so the other treatment option is, or the other treatment therapy is to control both of those disease states and to control them well. One is called hypertensive nephropathy. That means the blood pressure is doing damage to the kidneys. The other is diabetic nephropathy. That means the blood sugar is doing damage to the kidneys. When the blood sugar is high, the sugar floating around in the blood is like sand floating around in the blood. And as it's with every heartbeat, boom, 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 that sand is going through, it literally grinds the lining of the cells called the endothelial cells, makes them raw, irritates them. They try to repair themselves. You get scar tissue where you shouldn't have scar tissue. And remember, to get exchange of liquid, filtering of the blood, oxygenation, where oxygen with carbon dioxide becomes oxygenated, it only has to be one cell layer thick. When you get scarring, now you got more than one layer, so those tissues cannot function in the manner in which they're supposed to be, which is to exchange on the cellular level. So drinking 8 to 10 glasses of water per day, there is no substitute for water. So you can't say, well, I drink coffee or I drink tea or I had 2 Coca-Colas. None of that matters. What matters is that you get the 8 to 10 glasses of water in per day. Anything else is an addition to, not instead of. And one of the simple and elegant ways to do that is what Dr. Collier does. Whenever I have a cup of coffee, I get a glass of water. I finish the cup of coffee, I finish the glass of water. I refill the cup of coffee, I get another glass of water. That way, it virtually assures that I'm going to get 4 or 5 glasses in because I'm going to drink something else, orange juice, coffee, soda, Coke with my lunch. So that virtually assures I'm going to get almost enough water in. The other is when you take any medication or supplement, you take a full glass of water, not just a sip to get it down. So when I take Dr. Collier's Trio in the morning, that's omega-3 fish oil, vitamin D, and probiotics. I take each pill, I take a full glass of water, no sooner than 2 minutes later. What my regimen is, I wash my face, I take a pill. I brush my teeth, I take a pill. I shave, I take a pill. That way it's 2 to 5 minutes between each of those. A full glass of water and 1 pill on your stomach, it will dissolve in 2 minutes or less. That means it's out of your stomach, into your system, doing exactly what you want it to do, versus just sitting there because you only took enough water to wet it and get it down. And so now it turns into a thick gum and it's sitting on your stomach, and it may take all day to finally be absorbed. Whereas if you do it with a full glass of water, it is literally out of your stomach and into your system in 2 minutes flat. Great question, Natalie. That might be the question of the day. Okay. Mama Tim, 57. Do I have to get the shingles vaccine? Do I have to get the shingles vaccine? No, you don't. If you have a history of chickenpox, you have had the shingles, which is basically varicella virus or chickenpox virus. When the shingles vaccine was first developed, they said, well, if you have a history of chickenpox, you don't need the shingles vaccine because you have natural immunity. Guess what? The science of immunology has not changed. That rule continues. Then they start marketing and promoting, well, if you had the chickenpox, you may not have known it, or you could get it and you could still take the shingles vaccine. And that's true. You could if you want to do that. Then all of a sudden, everybody over age 50 needs to get the shingles vaccine. So there is no scientific reason for that to have manifested itself that way. I don't think we're seeing more shingles than we have traditionally in the past. I think that they're doing one heck of a job in marketing and promoting that shingles vaccine, because I have had extended conversations with people in reference to the flu vaccine and the coronavirus vaccine. They don't want to take it. They don't know what's in it. They don't want to do anything. They don't know how it made it too quick, whatever. And then as a conclusion, they'll ask me, but can you write me a prescription for the shingles vaccine? And I say, you just told me you don't like vaccines and gave me all the reasons why you don't like them. The shingles vaccine is exactly that. So again, you can get it. There's no downside to getting it. If you have had a shingles episode, now they're even saying you can get it after you recuperate from that. So they're saying over age 50, male or female, it was 60 and they lowered it to 50. And so now you can get it. Your insurance company will cover it, but you don't have to get it. Because most of us, if we're at that age, you're 57 now, that means you grew up when there wasn't a chickenpox vaccine. So you got the chickenpox, or you were exposed to it before you were 5. And so by kindergarten time, you definitely had been exposed to it and had natural immunity to it. So you shouldn't have any problems with it. Doesn't mean you won't get shingles. You can. You actually have to have had the chickenpox, because what a shingles outbreak is reactivation of the chickenpox virus that's been dormant in your body since childhood. Now, the question is, why does that happen? And will getting a vaccine prevent that from happening? And so that has been the case. You do enhance your immunity. You boost it, if you will, like a booster shot if you get the vaccine. But it's not a common disease state that just everybody has to be concerned about, oh, I'm going to get the shingles. No, doesn't mean you won't get it. You could get it, but chances are the vast majority of people don't. I'm not even sure whether everybody even knows. I'm going to say everybody knows someone that has had a shingles outbreak, but you don't. You've seen it anecdotally. You've heard about it at the beauty shop or the barber shop, but do you actually have somebody that you know that has had a shingles outbreak? If that's the case, then maybe you should consider it. Them having an outbreak has nothing to do with you having an outbreak. You don't catch it from them unless there's direct skin-to-skin contact with that. But the chickenpox virus is a respiratory virus. It's in the air. That's why kids get it. They go to school. One kid gets it and coughing and sneezing. The other kids get exposed to it. You don't have to touch them. All you got to do is be around them, and then you would get it. Okay, great question. Can I buy Lipodrops from Amazon? If I can, what can? Yolanda, you cannot buy Lipodrops from Amazon. The product that you see advertised on Amazon is a pirated product. It is not our Lipodrops. There are multiple products out now that are utilizing a same or similar name, but they actually have a product out there now that is using the word Lipodrops, the term Lipodrops, even though we have a patent on it. This is a big problem. I see it on Amazon. We see it on some other websites as well. The only place that you can get the official Lipodrops product are on our website, lipodrops.com. Lipodrops.com, where I'm recommending that you go to get your Lipodrops for weight loss and to make you lose weight from places that you cannot traditionally exercise it away from, like under the chin, under the arms, the outside of the arms, the inside of the arms, the inside of the thighs, the outside of the thighs, all those stubborn areas, and of course the abdomen. The catchphrase is lose the muffin top with Lipodrops. So the official Lipodrops on our website, maximum strength, only can be purchased at lipodrops.com. But since we're in the the cough cold season now, I highly recommend that we boost our immune system as well. You can lose weight, but the products that we have there, our Lipoimmune, outstanding. It contains vitamin C, it contains zinc, it contains elderberry extract, all natural supplements that boost your immune system. But you can get it all in one pill in our super great Lipoimmune product. And this was developed during the COVID pandemic because there was no other treatment. There was no vaccine to get. There was no treatment. So Dr. Collier would tell everybody, get your vitamin D at 5,000 international units per day. Get your vitamin D level up to 60, the normal range being 30 to 90, and you would optimize your immune system function. But other things that you could do, particularly to actually, if you got sick from it, the zinc, the elderberry extract, and the vitamin C. All of those are in the Lipoimmune product. Now, since then, one of the other super immune boosters that we have is the Lipo Shrooms. This is a mushroom-based product. Now, a lot of you out there are drinking mushroom coffee. When I ask, because it's one of the questions that I ask when people come in, do you smoke? Do you drink alcohol? Do you drink coffee? And I get a substantial number of people to say, well, I don't drink coffee. I drink mushroom coffee. Well, mushroom coffee, one, is not coffee. It's basically just dirt, and it looks like coffee. It tastes horrible. There's no good tasting, in my opinion, mushroom coffee products. You have to dress them up any ways you can, or you have to tolerate the taste that's not as pleasant. So what I would recommend is you take your regular Folgers, your regular Starbucks, whatever your favorite coffee is. You drink your coffee like you normally do, but you take the lipo shrooms instead. You take the lipo shrooms 2 a day, and your immune system, you'll get all of the benefits that you would get from mushroom coffee and then some, including weight loss, including decreasing foggy brain, enhancing mental acuity, but boosting your immune system. I really think all of those things are a function of your immune system being boosted. But for whatever reason, mushrooms have been shown to show great benefit in a variety of products. We developed the lipo shrooms product for just that reason. And so it's one of those things that if you want an immune booster, if you're thinking about some things that one, I'm getting foggy brain. There are lots of products on the market now. People are asking me all the time, can I take this for brain boosting? Well, our 2 brain boosters would be the CMOS, the Dr. CMOS, and the lipo shrooms. Both of those would have enhanced brain function as well as boost your immune system optimally. So our optimal immune product line would be the vitamin D at 5,000 international units, the Lipoimmune, which contains the vitamin C, the elderberry extract, and the zinc, and then the lipo shrooms. You at that point will be optimally immune. If you catch something at that point, you just had a substantive and significant exposure, or your immune system just isn't working for whatever reason, which is even a better reason to do that. And all of these products are compatible with any prescription medication that you could be on, any disease state. If you have high blood pressure, if you have diabetes, if you have high cholesterol, any of those things, you can still take anything on the Lipodrops website, and you shouldn't have any problems or complications. Great question, Yolanda. All right. Jerry Coleman, how can I remove skin tags without having to get them lasered off? Well, Jerry, there are multiple products that are available now. Things that used to be you had to get from the doctor's office. There are products that can freeze them. There are products that can chemically insult them. You just have to be very careful, because those products have to be used on the skin tag alone. So it takes a little expertise to do that. Some of them come with a big fat swab like a Q-tip, but it's like 10 times the size of a regular Q-tip. And you can stick it on the end of a can, it freezes it, and then the Q-tip is frozen. But you got to make sure that you're only touching the skin tag. If you touch regular skin, it's going to burn it. It's going to freeze it. It's going to discolor it. The darker your skin, the lighter the spot will be, and it's permanent skin damage. So oftentimes, you don't have to get them lasered off. There are other techniques that can be utilized at the doctor's office. There's dermabrasion. I can surgically remove them depending upon the size of the base. Then there's a technology called a hypercator, which is like electrocautery. It burns them off and it doesn't leave any scarring. So electrocautery is my go-to when I'm removing skin tags. And I tell you something about skin tags. You start off in life, your skin is flawless. I got a couple on my neck right now that I would like to remove. This one right here, you can see it. You can see it on the side right there, this way right here. Yeah, see, that monster is getting on my nerves. And so I would like to zap it out. You know, when I get a good medical student, I'm going to let them do it. But you can see it right there. They oftentimes come in places where you have skin folds, like under the arms, in the upper thighs. They can be a problem. But you start off with none, and before you know it, after a couple of years, you can literally have hundreds of them all over your body. And so removing it, it's removed. It's permanently gone. Doesn't mean you won't get one immediately next to the spot that you had the previous one. So you have to stay on top of them. But most people do. Once you've had them removed and you have a process in place for doing that, most people say, oh, I got some more skin tags I need to have removed. Okay, great question. Zandra Harris, is there a cure for claudication? Yes, there is. Claudication is when you get pain or weakness in your lower extremities because of poor blood circulation. There's medications that actually cause the blood cells to stack up nice little coins like poker chips. And so they flow easily or easier. But with claudication, the cells are oriented in a variety of different postures, so they don't flow well. In the blood vessels, you want what's called laminar flow, everything flowing smoothly in the same direction. If you get turbulent flow, where the cells are turning over and that creates a problem, they can bunch together and block the flow. Then you get backwash and you start to get swelling and edema in your lower extremities. But just cutting off the circulation cuts off the oxygen supply, and so you start to get fatigue, weakness, and sometimes even pain in the lower extremities. There are also surgical procedures that can improve blood flow. They can treat the veins and they can treat the arteries. They can stent the arteries. They can open up the veins, or they can close the veins totally. They can use a technique with hypertonic solution that's salt water that's highly strong, that irritates the lining. They wrap it up, the lining sticks together, and the artery, the vein rather, is closed off forever, and you just find another way for collateral flow. They can strip the vein. There's various ways to do it, but once you have claudication, it definitely needs to be evaluated. One of the simple things, if you have either cherry angioma, little spider veins, or if you have obvious veins, big veins on the legs, then you know that this is a problem, and you need to work with your vascular surgeon. There are places called like Vein Centers of America. Lots of vein doctors out there that are doing these techniques and technologies. Google vein treatments in my area and get an evaluation. Start out probably with an ultrasound of the blood flow to see what you got going on, see if there's problems with the valves in the arteries, which can create a problem, and we'll take it from there. Okay, great questions, Andra. Chuck D, I'm on Zepbound, and you mentioned one of your products can be taken so you don't get those Ozempic face. What is that product? That product is the Lipodrops. That causes your weight loss to be fat, and it shrinks the area, but it controls the areas that you're losing the fat from better than not taking that. So the Lipodrops Maximum Strength can be taken along with the GLP-1. 1 drop of food before meals, 1 drop of food before breakfast, or depending upon where you are on your weight loss journey, if you're trying to catch up, you can take it with each meal, breakfast, lunch, and dinner. So that product and products like that have been shown that to greatly improve the sinking in of the where you lose all the fat in your face, and now you have that look called or affectionately Ozempic face or GLP-1 face. Many examples of it on the internet. You may see people that are in the media on television, etc., that have overdone it a bit, and now they look a little strange about the face, but not just the face, under the neck, the jowls, their whole body now is no longer. At first, they're overweight, they're thick, then they start to lose the weight, they look good, they're just a little thick, but then they get thin, and now they probably the best they're going to be, but they don't stop, they keep going, and now you're losing weight, you start to look gaunt, or like something is wrong. And now instead of looking healthy, you look ill, that you are in dis-ease, a dis-ease state, which is what disease. And so one of the things you can do to prevent that versus catching up with it would be go to the lipodrops.com, lipodrops.com website. You'll see my picture, and you can get the Lipodrops Maximum Strength. We also have one with African Mango. That is an additional weight loss product that's natural as well. Great question, Chuck D. Nadia Quant, I just turned 30. I really want to start prioritizing my health. It's a good time to do it, Nadia. You didn't wait till you were 40. I would like to know what is a good daily vitamin I can take that can increase my energy and better sleep habits. There's no one product, but one Dr. Collier's trio that I recommend for everybody, young, old, black, white, male, female. 3 things: omega-3 fish oil, which kind of oils the joint. It has a natural anti-inflammatory and it's anti-aging. The vitamin D, but at a therapeutic dose of 5,000 international units per day. A lot of people taking vitamin D, but they're taking sub-therapeutic doses. It's a total waste of time. Commonly, when I see vitamin D available over the counter at 600 milligrams, 800 milligrams, that's a complete waste of your money unless you're taking 5 of them at a time. So you want to take one product, my Doctor's D, 5,000 international units, very small caplet or tablet that you can take that gives you all that you need, and you can get the benefits of that. And then probiotics, God's gift to good health, immune health, changing the amount of inflammation in your body, changing your gut biome. Those 3 things, in addition, the final thing I recommend, a complete multiple vitamin with iron and minerals. A complete, that is the key part of that phrase, complete, because a multiple vitamin just means it has more than one. Anything less than that, maybe I see people when they come to my office with a grocery bag full of, I have vitamin E, and I have vitamin D, and I have vitamin C. They got different bottles with all these things. Well, guess what? You can get all those things in one bottle. Now, you can't, there's no vitamin, no complete multiple vitamin that has the 100% of the daily equivalent of vitamin D, because it just won't chemically bind. The tablet will be the size of a golf ball. Actually, probably about the size of a lifesaver, but that's still too big to swallow whole. So you need to take the vitamin D separately. But a complete multiple vitamin, I like one a day for men or one a day for women. Centrum, Z-Bec, or name brands, but there's no such entity as a generic vitamin. A vitamin is a fixed chemical formula. There's no better way to make it. So if you're in the store and you see a branded product and then you see next to it Target brand, Kroger brand, Publix brand, compared to branded product, then get the less expensive one. Because when you're spending more than 10, 15 bucks for a bottle of 100, you're paying for a pretty label or a celebrity endorsement. So one of those others. But so vitamins are great. Most people have vitamins at their homes right now. And the bottle is not even, it's unsealed, never been opened. It's just sitting there, in the medicine cabinet, on the sink, on the cabinet. You got to make sure that it becomes a regular part of your personal culture that you take these products. So if you get Doctor's Doctor's Essential Trio from the Lipodrops.com website, Lipodrops.com, you can get that. You take those three. I told you what my regimen is. And then you get the vitamin in at some point. There is no product that we have that you have to take with food. You don't have to eat to take any of them. But the omega-3 fish oil in particular, because it's oil-based, is absorbed better with food. But you don't have to eat to take it. I take it all the time without food. I take 2 a day, 1 in the morning, 1 in the evening. And more often than not, I don't have food when I take one of them. Sometimes both of them. But when on the weekends, it's a little easier. I'll take because breakfast is right there. So I take it with breakfast and take it with dinner. But other than that, you don't have to have any food to take any of these products. It's just a matter of drinking enough water. A full glass of water, not just a sip to get it down. Great question, Maddie. Monica H., can you recommend the best brain learning supplements? What do you think about L-tyrosine and ginkgo biloba? I like both of them. L-tyrosine is available in a lot of products as well. But again, I like my Dr. CMOS as one of the best brain supplements that you can get. And then I also like the lipo shrooms. So both of those things. I wish there was magic in a bottle that you can take and then you can ace the SATs or any other test that you have. That's not what we're talking about. We're talking about a sense of alertness so that you feel that your thought process is correct. You're not walking in a room and forgetting why you came in there, or opening the refrigerator and forgetting what you're looking for, or going and park your car and can't remember where you parked. All of these things are life phenomena that are real. And, but I get people also to say, I work on a computer, I work in a job that's high tech, and I noticed that, I'm either making more mistakes or I'm not focused. And so those products I highly recommend. The CMOS, the Dr. CMOS, and the Lipo Shrooms products are 2 that are available on the Lipodrops website, lipodrops.com. And I tell you, there are great things and great benefits from taking both of them. Great job. Okay, Rhea Fletcher, can you take a GLP-1 if your A1C is low, 3.9 to 4.1, but you're overweight? Yes, you can. You don't have to be a diabetic to take a GLP-1. And I'm not even sure whether there is such a thing as a too low A1C, but I know that there are people that have perfectly normal A1Cs in the range that you're speaking of that are on GLP-1 therapy for weight loss, because there are other portions about insulin, peripheral body fat, muscle use of glucose as a fuel, all those things tied together. And so people safely take them all the time. It is highly unusual to get a low blood sugar from GLP-1 therapy. It is highly unusual, even because you're eating less and your blood sugar still doesn't drop too low. But I'm sure there's a few exceptions rather to that comment that I just made. I have not seen it in my medical practice, and I'm treating people that have diabetes. They're being treated with Ozempic and Mounjaro, or a similar or same product, and people that are just overweight that want to lose weight that are on the Wegovy and the Zepbound. All of them are GLP-1s, and all of them work amazingly well. I think this class of drug is the greatest breakthrough in the practice of medicine since I have been practicing, because once again, they work. They lower the hemoglobin A1C, they decrease the blood sugar level, they make you lose weight. They decrease the incidence of heart attacks and strokes. They improve kidney function. There's so many benefits that are all, I am sure, due to just the weight loss and taking that stress out of your body. Do you know that a 10-pound weight loss takes 40 pounds of pressure off your knees? 40 pounds of pressure off your knees from just losing 10 pounds. So there you go with that. That, all those great benefits. So the answer to the question is yes, you can take a GLP-1. Okay, Holly, that was our final question. Okay, we'll take that one. Okay, Shalonda Fitzpatrick. I'm always bloated and go days without doing number 2. My iron levels have never been higher than 8, and I have no sex drive. Shalonda, you got several things going on. One, you need to boost your iron up because you have anemia. Because you have anemia, when you don't have any energy, you don't have any energy for sex, so your body just shuts down your desire to have sex. When you're bloated, you go days without doing number 2. That is a problem. You need to do 2 things. One, my Lipo Cleanse product, and you need to change your gut biome with the Lipobiotic. Taking the probiotic and taking the Lipo Cleanse is that what we call our belly fix combination that will decrease the bloating, that will allow you to have normal, large, easy to pass bowel movements on a regular basis, hopefully at least once a day, but no more than 2 days between them. You got to make sure you're drinking enough water. Once we fix that back up, you're no longer bloated and having that problem, then your energy level will go up. You'll be able to get your blood, your iron levels up, and then you will spontaneously have an increase in your sex drive. But if not, we have a product, Lipo-Hers. Lipo-Hers will bring the fire. It's like you take it daily and it boosts and enhances your libido. It boosts and enhances your sexual function, makes your vagina thick, moist, wet, and ready to receive, and it enhances the intensity of your orgasm. So if your orgasm is already 5, there'll be 10 plus on the Lipo-Hers, Hers product. Go to the website, lipodrops.com, and check out everything that we have to offer for you. It is the cough cold season. We want to make sure that you're boosting your immune system. Get the Lipo-Immune, get the Lipo Shrooms, those 2 products. And again, omega-3 fish oil and vitamin D at the 5,000 international units per day Dr. D preparation. All of these things will make you a better you. Let's get through this one together. Next time you're in the drugstore, do get your flu shot, and tune in next time to Ask Dr. MJ Why, because your health is important. And we're going to close out with the theme song. It's called survival. We want to be the best that we can be. It's called survival, 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 survival. The Hip Hop Doc Posse. Dr. MJ Collier, I'm your family physician. Excuse me, why? My mission. Original Hip Hop Doc. Don't you deny it. I can surely supply it. Hooray. Don't even try it. Too bad. I've been curing ills for years before you even died. I've been in studios here on YouTube. If you have a question for me, I can understand why they try to be me. The hip hop doc is the bomb and the best as far as the eye can see. I'll be keeping it real, making it plain, keeping your filthy free of pain. Real no jive to keep you alive. I don't mean to brag or even boast. I am your medical doctor and your radio host. I am the original hip hop doc. Say it again. I am the hip hop doc. I am the hip hop doc. There we go, ladies and gentlemen. The hip hop doc, Dr. MJ Collier, closing out this episode of Ask Dr. MJ Why, because your health is important. Thank you so much for joining us. Tell all of your friends. They need to tune in Wednesdays, 6:30 p.m. Eastern Standard Time to capture this healthcare information. And I'm charging each and every one of you to be ambassadors for health. The information that you heard tonight is universal. You can share it with all of your friends. Share it with your family members. Don't just keep it to yourself. Tell them, I heard Dr. Collier said, and quote me and say it specifically. I keep it 100 with you, and everything that I tell you is medically sound. So take that care of that, and we'll see you next time. Thank you, Holly, for a great show.